Texas faces a severe shortage of primary care providers, a problem that stretches from our rural areas to our major urban centers. The Texas legislature is currently considering a dramatic plan to address this shortage by providing financial incentives for those willing to serve in medically underserved areas. Healthcare providers, patient advocates, and community leaders from the Bryan-College Station area gathered at the Brazos Valley Community Action Agency to lend their support to this historic proposal.
At a time when the nation's unemployment rate is at a 26-year high and employers seem to be doing more firing than hiring, there is one field that is constantly looking for a few good men and women. There is no shortage when it comes to jobs in the medical field, just a shortage of medical professionals. News 3's Kristen Ross takes a look at the growing problem and how our region is working to find a solution.
Well, what can I do for you today?
They're there when we're often feeling our worst.
Sinus, whatever this blood is.
But could growing patient needs soon outweigh those who can fix the problem?
Specifically in the rural areas, their shortage really has to do with the types of issues that go on in the rural areas relative to recruiting.
As the medical field grows, so does the need for more doctors and nurses.
When physicians come out of medical practice, they're looking for specific lifestyles, which some communities may or may not offer depending on its size.
In some cases, positions here in the Brazos Valley go unclaimed for years. One clinic in Leon County has been looking for a physician for more than 2 years.
So the assessment?
But it's that availability of jobs and job security that has many students confident about finding work.
My hometown's in Katy, west of Houston, and right now there are 3 hospitals going up just in that area that will be finished by the time I graduate.
There's always going to be sick people, so I feel like there's going to be, always a need for nurses and doctors and stuff. Absolutely, no matter what the economy is.
After delivering medical equipment, Larry Calzonson realized he wanted more. Now he's at Bryan-College working toward a nursing degree. It took him a couple of tries just to get into the program.
It's always been maxed out. There's always somebody been trying to get in. There's always been a waiting list.
We have far more applicants than we have slots.
Despite the interest in school programs, Thena Parrott with Blend's nursing program predicts the demand for medical professionals will only increase in the future.
All of us baby boomers, as we age and have more health care problems, then the needs are going to be greater.
The question now, will there be enough doctors and nurses to support it?
Any other medications you take on a regular basis? Is this your right?
Well, officials with the Texas A&M Health Science Center's College of Medicine say they're trying to address shortages in the medical field by increasing their class sizes. Now, back in 2006, they only took 80 students per class. This year, they plan to take on 150 students, with a goal of accepting 200 students into a class by 2011. Live in the News Center, Kristen Ross, News 3. Local healthcare providers, patients, and community leaders will address the shortage tomorrow at the Brazos Valley Community Action Agency. On their agenda, getting lawmakers to pass legislation that would pay off student loans for those healthcare providers who practice in rural areas of the Brazos Valley for 4 years.
We feel like this is a very important tool to allow us to be able to recruit more physicians in underserved areas throughout our service delivery area, the 7 counties, as well as assist folks in the outlying, in the rest of Texas. Very important bill.
Representative Colcourse from Grimes County is the new chair of the Public Health Committee, which this bill went through. Representative Colcourse is a huge rural advocate. She's a huge advocate for health care. And having her on the Public Health Committee is very good for us.
We've been challenged for years to get providers in our medically underserved areas.
Central Texas health officials say they need doctors in rural areas, but those doctors have big college loans to pay off.
Average student, when they leave medical school, has a debt of about $160,000, and this bill will allow reimbursement for loan repayment.
The bill will pay up to $160,000 of school debt over a 3 or 4 year period.
Some doctors are coming out of school knowing that, going, if I work in an underserved area, I'll be able to seek some loan repayment. So they're asking that question right up front.
Anything that can be done that makes it a little easier for folks to pursue an education in health care are going to be critical to the businesses in this community.
And he says health care is good for business.
You're running the risk of having an unhealthy workforce, which is going to have a lot more time off and absenteeism issues.
The bill will be footed by a higher tax on smokeless tobacco.
A positive way to use tobacco for health care. It's got plenty of negative effects. It's a good way to use it for some positive effects.
It's got to come from somewhere, but I think the critical thing is that the opportunity needs to be there, however it's funded.
Loan reimbursement will be given on top of the healthcare professional salary. In Bryan, Laura Neal, Fox News, Central Texas.
And community leaders gathered this morning to address a growing problem in the Brazos Valley, a doctor shortage. On today's agenda, House Bill 1876. The legislation would help pay off student loans for health care providers who agree to work in underserved areas of the state for a 4-year term. The average medical school graduate piles on more than $150,000 in loans while in school. Advocates say the bill could help bring qualified physicians to rural parts of the Brazos Valley.
We hope that you'll get out and ask your legislators to support this bill. We really feel it's important for the health of our community.